All right, well, colon cancer is one of the leading forms of cancer deaths in our country, and while it's more common in older adults, there is a concerning rise in cases among younger adults in their 30s and 40s. So Dr. David Winter of Baylor Scott and White Health is here to explain this troublesome new finding. Good morning to you. As always, we're so happy to have you here.
Good morning. Good to be with you.
All right, so what's going on? Why is colon cancer on the rise?
You know, we're not exactly sure. Some of the things they think may be a factor is if you're overweight, causes some inflammation, maybe that. If you eat a lot of animal fat, animal protein, if you smoke, if you drink a lot of alcohol, those things maybe, but we're not really sure. More science needs to be done to know for sure what's going on, but it is on the rise in younger people.
It's a disturbing trend, to say the least. So let me talk a little bit about, what are some signs that younger folks, or anybody for that matter, can kind of look into if they're starting to see some symptoms. What are some of those common symptoms?
Yeah, abdominal bloating, distension. You can have weight loss, major fatigue will happen. Sometimes blood in the stool. The problem is all these are late markers of the cancer. In fact, with cancer caught late, it's like a 10% survival rate. Now, if you catch it early, though, it's 90%. So the concern is right now, too many people put off their colonoscopies. In fact, we know in studies that 30 to 50% of people who should get a colonoscopy have delayed it.
Well,
so that's the problem.
And I think the biggest challenge is, just candidly, the idea of having a colonoscopy, having to do the prep work,
Correct.
Going in, it's something that would be easy for one to put off. But what you're saying is really helpful because it is something that we should be taking very, very seriously. And it's important that these procedures are in place so that you can be properly screened.
And actually with a colonoscopy, they can actually find early cancers and take them out. Or precancerous lesions like a polyp or what we call a serrated adenoma, that can turn into cancer. So it's actually preventive if you get a colonoscopy.
All right, good. That's very good advice. All right, so at what age should you start getting screened for colon cancer? Well,
the U.S. Preventive Task Force and the American Cancer Society both say at age 45 you start getting some kind of study done. If you have any cancer in your family, though, any colon cancer in your family, you have to start earlier. If you have some of these genetic syndromes, if you have inflammatory bowel disease, with those, talk with your doctor because you may have to get them even earlier than that. But age 45, you should start the process.
But when you also were talking about that you're seeing it in younger folks, remind me, what age are you starting to see these in? Are you seeing them in the 30s, for example? Is it something that we should really consider even at that young of age?
Well, the thing is that colon cancer, when it starts, usually takes 10 years to mature and get to the late stage. So if you catch it within the first 10 years, you're okay. That's why we say start early.
Okay.
It may be in the 30s, but if you catch it by the 40s, you should be okay. That's what the data tells us right now.
All right, well, let's also talk about something that's definitely in the headlines. Prime Deion Sanders, Coach Prime, University of Colorado, certainly has a lot of Dallas roots. He has been battling with bladder cancer, and that with that kind of top of mind. I know that these are two completely different cancers that we're talking about, but can they be confused somehow with colon cancer, and what is the distinctions?
Well, they can have some similar symptoms. You can have abdominal bloating, some cramping. Typically with bladder cancer, though, you'll see some blood, some red urine, so that's kind of a tip-off. Trouble urinating, that's another clue maybe. So the symptoms are a little bit different.
Right, well I'm so glad that you brought this to our attention. I think that we all need to be aware, especially since we're seeing this trend of younger people experiencing colon cancer. We have also heard about these options that are available through the mail that you can do it in the privacy of your home. Are they as effective as getting an actual colonoscopy?
Yeah, there are a couple things you can do instead of colonoscopy. So there are these stool tests. They pick up fragments of blood. They pick up fragments of cancer cells. You can also get a blood test that does the same thing. They're pretty good. They're not quite as good as colonoscopy. In fact, if they're positive, you have to get a colonoscopy. But if you're not going to get a colonoscopy, at least do that because we're picking up cancers with those also. All
right. Well, this is great information as always. Thank you so much for coming in. We appreciate it. And one more thing before you go, where can people find you for more information?
Oh, bswhealth.com.